Doctor, I was told during a health checkup that my blood pressure is high. I looked it up online, and there's a lot of scary information out there. But I don't want to take medication. Is there any way to naturally lower my blood pressure?
Hello. High blood pressure does indeed come with many health risks, but first, please don't worry. There are many ways to improve blood pressure by changing your lifestyle without relying on medication. Today, I'm going to explain these methods clearly.
Really? Thank you so much. Your explanations are always easy to understand. Can you tell me a little about your YouTube channel?
Of course. On this YouTube channel, I explain medical and health-related questions in an easy-to-understand way. We focus on lifestyle diseases such as hypertension and diabetes. Please subscribe to the channel, and if you find the content helpful, give it a thumbs up and share it on social media.
Got it, I've subscribed right away. So, what happens if I leave my high blood pressure untreated?
High blood pressure is often called the silent killer because it doesn't show many symptoms until it causes serious health issues. If left untreated, it increases the risk of severe conditions such as heart disease and stroke. Continuous high blood pressure puts a strain on the heart and brain, which can lead to sudden death in the worst cases.
Sudden death? That's terrifying.
Yes, and in addition to that, the ongoing strain on the heart can lead to heart failure. High blood pressure can also cause blood vessels in the brain to rupture, leading to a stroke. Strokes can result in paralysis, impacting your daily life significantly and possibly requiring lifelong care.
A stroke sounds really scary. What else can happen?
High blood pressure can also damage your kidneys, leading to kidney function decline or kidney failure. Moreover, it can affect the blood vessels in your eyes, causing vision problems. Essentially, high blood pressure can harm blood vessels throughout your body, leading to various complications.
So it affects the whole body. But I really don't want to take medication. How can I avoid these risks?
Today, I'll explain 8 ways to lower blood pressure without relying on medication.
Please do.
The first method is reducing salt intake.
How does salt affect blood pressure?
Excess salt in the body causes it to retain water to dilute the salt, increasing the volume of blood and putting more pressure on blood vessels, which raises blood pressure.
I see. So how can I reduce my salt intake? Any tips?
Good question. Start by not putting salt on the table during meals. Use herbs and spices for flavor instead of salt. Also, processed foods and eating out often contain high amounts of salt, so cooking at home is better. Reducing the frequency of eating out is important.
Reducing eating out and cooking at home sounds challenging, but I'll try for my health. What herbs and spices should I use?
Garlic, ginger, basil, and rosemary are great for adding flavor to dishes without extra salt. Use these to make healthy, low-salt meals.
Thank you, I'll try that.
The second method is losing weight.
How does weight affect blood pressure?
That's a crucial point. As body weight increases, the heart has to pump more blood to supply the additional fat tissue, which raises blood pressure. Maintaining a healthy weight is very effective in lowering blood pressure.
So I need to diet? What kind of diet should I follow?
Rather than drastic food restrictions, focus on balanced meals. Eat more vegetables, choose whole grains over white rice, and limit high-fat foods. These daily food choices are key.
Can I buy whole grains at a regular supermarket?
Yes, many stores now offer health-conscious products. Choose fish over meat and focus on the quality rather than quantity of your food.
What do you mean by focusing on food quality?
Choose low-fat, nutrient-rich foods like steamed vegetables, salads, and tofu over high-fat options. This way, you can avoid overeating while getting essential nutrients. Regular exercise is also important.
I understand. I'll start by reviewing my diet. Thank you.
The third method is exercise.
Does exercise really help lower blood pressure? I'm not good at exercising. What simple exercises can I do at home?
Yes, exercise is very effective. Regular exercise improves heart efficiency and blood circulation, naturally lowering blood pressure. Simple home exercises include stretching, squats, and push-ups, which don't require special equipment and can be easily added to your routine.
How intense should the exercise be and for how long?
Start with light activities like walking and gradually increase your activity level. For example, 30 minutes of brisk walking daily can significantly impact blood pressure. Add more intense exercises 2 to 3 times a week for better results. Start small with manageable frequency and intensity.
30 minutes of brisk walking daily sounds doable. Are there other exercises I can do at home?
Yes, try chair-based leg lifts or arm circles while watching TV. Start small with manageable exercises. Consistency will bring positive results.
I'll give it a try. Thank you.
The fourth method is managing alcohol intake.
I've heard alcohol is bad for blood pressure. Do I have to stop drinking completely?
Alcohol can temporarily raise blood pressure, and habitual drinking can keep it high. You don't have to quit entirely, but managing your intake is crucial.
What drinking habits should I follow?
Limit alcohol to about 2 cans of regular-sized beer for men and 1 can for women per day. Have alcohol-free days during the week to give your body a break.
Is non-alcoholic beer okay?
Yes, non-alcoholic beer contains little to no alcohol, so it's a good alternative.
I'll be mindful of my alcohol intake.
That's important. Moderate drinking can be relaxing but stay within healthy limits.
I'll try to cut down on alcohol for my health.
The fifth method is eating more fruits and vegetables.
How do fruits and vegetables help?
Fruits and vegetables are rich in potassium, which helps the body eliminate excess sodium, naturally lowering blood pressure.
What foods are high in potassium?
Bananas, oranges, tomatoes, potatoes, and beans are all high in potassium. Incorporate these into your daily diet for a heart-healthy lifestyle.
But fruits and vegetables can be expensive.
Choose seasonal produce and buy fresh, local items from markets to save money. Their high nutritional value means you don't need large amounts to see benefits.
I'll look for fresh produce. Are there other heart-healthy foods?
Omega-3 rich fish like salmon and mackerel, whole grains, and nuts are also great. Aim for a balanced diet.
I'll try that. Thank you. Your advice eases my health worries.
The sixth method is quitting smoking.
I know smoking is bad for blood pressure, but quitting is really hard. What effects does smoking have?
Nicotine in cigarettes constricts blood vessels, temporarily raising blood pressure. Over time, it hardens arteries, increasing the risk of heart disease and stroke.
That sounds bad. I've tried quitting many times and failed.
Quitting is tough, but there are strategies to help. Avoid smoking environments, find other stress relief methods like walking or deep breathing, and consider using nicotine patches or gum. Support from a smoking cessation clinic can also be helpful.
I'll consider a cessation clinic and talk to friends who've quit.
Hearing success stories can be motivating. Quitting smoking will improve your overall health and lower blood pressure.
I feel more hopeful now. Thank you.
The seventh method is improving sleep quality.
How does sleep affect blood pressure? How can I get better sleep?
Good sleep stabilizes blood pressure and reduces heart disease risk. Poor sleep prevents the natural drop in blood pressure, keeping it elevated.
How can I improve my sleep?
Set a regular sleep schedule, avoid caffeine in the evening, and create a dark, quiet, comfortable bedroom environment. Limit screen time before bed and practice relaxation techniques like stretching or meditation.
It's hard to put down my phone, but I'll try. Stretching and meditation sound good.
Give it a try. Good sleep benefits overall health and helps manage blood pressure.
Thank you, your advice is very encouraging.
The eighth method is managing stress.
Work stress is high, and I worry it's affecting my blood pressure. How does stress impact the body?
Stress triggers the release of hormones that constrict blood vessels, raising blood pressure. Chronic stress keeps blood pressure elevated, leading to hypertension.
How can I reduce stress?
Try deep breathing, meditation, hobbies, and exercise to manage stress. Build good relationships and get enough sleep.
Finding a hobby sounds good. Any suggestions?
Choose activities that relax you, like listening to music, drawing, or gardening. Enjoying and forgetting stress is key.
I'll create time to relax after work.
That's a great approach. Managing stress reduces its impact on blood pressure.
I've heard meditation helps reduce stress. What do you think?
I practice meditation and affirmations daily and find them very effective.
I'll try meditation. Talking to you makes me feel positive.
I'm glad to hear that.
Thank you for all the advice today. What should I do next? Any final tips?
Let's summarize. Improving blood pressure involves lifestyle changes, reviewing your diet, exercising regularly, moderating alcohol, eating plenty of fruits and vegetables, quitting smoking, getting good sleep, and managing stress. Implement these changes gradually. Focus on diet this week, add exercise next week, and so on.
I see, gradual changes make sense. But starting alone feels daunting.
You're not alone. Seek support from family, friends, and professionals. Use this YouTube channel as a resource. I hope viewers find today's discussion helpful and take steps toward a healthier life.
I'll talk to my family and start small. Thank you.
That's wonderful. Taking action is the first step to health. Reach out if you have questions or concerns. I encourage everyone to use today's tips and take steps toward lowering blood pressure. Let's strive for a healthy future together.